Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida at the Hauser Neck Center in Fort Myers, Florida. A common complaint that I hear almost every day on new patients that come in is that they have a choking sensation and they have episodes of panic because it's difficult to breathe. So this was a patient who told me after the car accident I would feel like I was choking and I couldn't breathe. I always felt like there was secretions in my throat and that were going down into my lungs. Then I couldn't breathe, like my airways were getting blocked. Patients come in with just so many symptoms, and you'll see that one of the symptoms is a choking sensation. But cervical dysstructure or cervical instability can cause slurred speech, personality changes, insomnia, or always feeling fatigue, lightheadedness, light sensitivity, ear pain, ear pressure, various kind of headaches, head pressure, lots of anxiety, autonomic storms, cognitive decline. If you're at home seeing me for the first time and you're like, this is kind of all interesting stuff, and you're trying to figure out, is my choking sensation something related to my neck? The question is, do you have clicking, popping, grinding in your neck? Have you been somebody who has been on the computer for years? So instead of your neck curve being like this, that's the normal curve, everything would be in its relaxed state where this stretches everything when you look forward. Even if you have a normal neck curve, if you're always looking down, even if it's like studying for an exam or writing an article or looking at YouTube or searching something on the internet, that constant position with the atlas so far forward, it's going to stretch and compress your vagus nerve. And when you look up what innervates the vocal cords, so you and I can speak, you and I can swallow properly, you eat food, and it goes down into your esophagus instead of your lungs, it's because of the epiglottis, which we'll talk about. All these things are innervated by the vagus nerve. The two main causes of vagus nerve injury or dysfunction is going to be incredible stressors or a change in the neck curve, which I call cervical dysstructure. So if a person, because of a forward head lifestyle or a car accident or something, if their curve is like this instead of like this is going to kink the vagus nerve or stretch and compress the vagus nerve at the atlas. And long term, that can cause the vagus nerves to get smaller. Vagus nerve inputs to the larynx, to the vocal cords, to the epiglottis, to the swallowing muscles, and that can lead to choking. It can lead to difficulty breathing. The other nerve that's involved with it, of course, is the glossopharyngeal nerve. The vagus nerve is cranial nerve 10, the glossopharyngeal nerve is cranial nerve 9, and they run together in what's called the carotid sheath. So they both innervate the muscles involved with swallowing. What we do in the office is called a digital motion x-ray, which is an x-ray of the movement of your bones, so it's in real time. And with neck instability, the two adjoining vertebrae, they go like that, like it slips forward, and that's a sign that the connectors are loose. The connectors are the ligaments, so if you have ligamentous cervical instability causing the vertebrae to move in destructive ways where the vagus nerve gets injured, and that's causing a choking, shortness of breath, change in voice, inability to sing. Singers who have trouble singing, where at one point they were great singers, it's probably a vagus nerve problem, probably coming from your neck. The treatment to regenerate or tighten or thicken ligaments is called prolotherapy. And basically, I'm a prolotherapist. So swallowing, there's lots of different things that happen with swallowing. Well, obviously, a person eats something, or even, do you know 1 or 2 times a minute you swallow saliva? Like, you don't realize how many times you actually swallow saliva. So the saliva you want to go into your esophagus, not into your lungs. So the way it doesn't go into your lungs This would be the larynx, which would go into your bronchus, which would go into your lungs. There's a thing called the epiglottis. So the epiglottis closes off this space. So say right now I'm going to swallow saliva. So I didn't choke on it. So the saliva went into my stomach instead of my lungs. So if you're ever eating food and you choke, or for no reason you start choking like something went into the windpipe, the larynx, into the lungs, or you're just like your saliva went into the wrong place, that's because the epiglottis isn't closing off. And here, I'll just show you. We do cone beam CT scans. So this is, we have this scanner in our office. There's the epiglottis. See it there? So you have your pharynx here, then you have your larynx here, and this thing closes off right here. So when you swallow something, it goes into your esophagus, which will be over here, right? So this is all air, right? This is all air. That's what you're seeing with the black there. People with epiglottis problems, I'll see the epiglottis stuck right here, like it's stuck right there. And when you swallow something, this is supposed to close this off, the epiglottis. Well, of course, the epiglottis is innervated by what? The vagus nerve. The vocal cords, we're able to speak because of the vocal cords. So imagine if the vocal cords closed off all the time. You would feel like, I can't get air, I can't get air, I can't get air. Because they're muscles. So they're innervated by the vagus nerve. So, if you have vagus nerve dysfunction, you have vagus nerve injury, or all it takes is a 5% stretch of a nerve, right? So this elongates. So say somebody has a straight curve instead of a lordotic curve, and the vagus nerve is getting stretched 5%, 10%. Some of the impulses may not go to the vocal cords, so then the vocal cords close up. One vocal cord is struggling over another, and when that happens, you get a choking sensation. Your voice may change. You may feel like, geez, I can't breathe, I can't breathe. And then you'd say, well, what's the treatment? Well, if the treatment's like, if your curve is terrible, you have to do a face-up lifestyle instead of a face-down lifestyle. So you got to get your computer system up. And then if you have instability, you have ligament damage, then you get prolotherapy to stimulate the ligaments to repair. I have a patient right now who has chronic aspiration pneumonia. So in other words, she continually is having saliva and food when she eats. It goes into her lungs. So then she continually gets infections. So we're treating her, and gradually the epiglottis is starting to work, and then she doesn't aspirate so much. So here's the vagus nerve, the ganglion, and when you hear the word ganglion, it means that those are the cell bodies where the DNA of the vagus nerve is. The ganglions sit right in front of C1. So the DNA of the vagus nerve, and there's 100,000 nerve cells in the vagus nerve, 100,000 on the right one and the left one. So imagine if the very DNA, the cell body of all these 100,000 neurons is just getting annihilated at C1. That's going to cause what? The death of vagus nerve cells. So in the office here, what we see is what? The vagus nerves are smaller and smaller and smaller. If the vagus nerves can't innervate the vocal cords, well, the vocal cords could stay closed. Then you're going to choke, you're going to feel short of breath, and if the epiglottis doesn't work so right, you're going to what? Saliva is going to go into the lungs instead of the stomach, or food's going to go into the lungs instead of the stomach, and then you're going to choke. Now, depending on what branch of the vagus nerve is affected, that will affect symptoms. So if the vagus nerve branches to the stomach are affected, then of course the stomach doesn't work and you get bloating, nausea. If the vagus nerve branches to the lungs don't work, you get shortness of breath, you could get asthma, you could get hyperactive airway. Obviously, if the vagus nerve branches to the heart don't work, you could get an arrhythmia, you could get tachycardia, dizziness, postural orthostatic tachycardia syndrome. The vagus nerve branches to the small intestine or the intestine, then you get constipation, you might get irritable bowel, inflammatory bowel disease, leaky gut, food sensitivities, and of course if the pharyngeal branches, so the vagus nerve sends branches to the vocal cords in the epiglottis, the superior inferior laryngeal branches of the recurrent laryngeal branch, that will give you shortness of breath, it can give you hoarseness, difficulty singing, eustachian tube dysfunction, ear pressure, swallowing difficulties, dizziness. And then this just shows you that if you get upper cervical instability, so you get upper cervical instability and it damages the nodose ganglion, that's the vagus nerve ganglion, you can get, vertebral basilar problems, lung problems, heart problems, high blood pressure, torticollis, trigeminal neuralgia, hoarseness, arrhythmia, beside choking and shortness of breath. And then if you want to look at yourself in a mirror with good lighting, go ah, and you might have the uvula deviate. This is the uvula, or in this particular patient, see how this one is, the palate is lower than this side. So this person has vagus nerve dysfunction or decreased vagal nerve inputs to this muscle right here, which is the levator veli palatini muscle. So it's not working so good. So sometimes when this muscle isn't working good, this muscle is working good, the uvula deviates to this side. So this person has a right vagus nerve degenerative problem. And then this is what we see under ultrasound. So you see the vagus nerve here, and then sometimes you'll see the vagus nerve is under stretch or compression. So you can see where normally the vagus nerve is circular, you see here where it's stretched. This is the nodose ganglion, that sits right at C1, but see the vagus nerve, see how long it is, and see the recurrent laryngeal nerve, how it goes up. So your cervical curve or your neck is right here. So any problem in here can affect your vagus nerve. So that's kind of an important point. You could have instability in the middle of the cervical spine and it affect your vagus nerve. And cervical instability is at the core of TMJ, hyoid, head, cervical, thoracic relationships. The only reason why I put this in here is there's people that get diagnosed with lots of different things. For instance, a person might have like facial pain, or the dentist wants to do a procedure and the person doesn't realize their bad bite is because of TMJ instability. Like what they really need is just, if you got clicking, popping, grinding of your TMJ, get prolotherapy to tighten it. Or somebody says, I'm just telling you, I got a clicking, popping, grinding sensation right here. Well, you probably have hyoid instability, you just need some prolotherapy. Okay, this is just in-house data on 138 patients. We haven't published it yet. Most vagus nerves should be 1.8 millimeters in diameter. We had 47% of our 138 new patients in a row. This is from 2021. The vagus nerves were less than 1.2 millimeters in diameter, so they were severely affected, at least the patients who come to the Hauser Neck Center. And let's remember the vagus nerve is basically named for the Latin, because vagus means wanderer, because the vagus nerve innervates the whole digestive system. And sometimes we forget that it's the main innervation of the vocal cords and the larynx. And this kind of just shows that you have the nodose ganglion, superior laryngeal nerve, the extra laryngeal nerve, and it basically innervates all the vocal cords. And then basically what you see when an ENT doctor does a laryngoscope, you'll see that one of the vocal cords doesn't work like it's supposed to open. This one, this side isn't opening. And you can understand where if you have bilateral paralysis, there's very little room for air to go, right? And then that would give you significant shortness of breath. What we do in the office here when we think somebody might have vocal cord problems, we do an ultrasound. and then we measure the vagus nerves, and then through curve correction and prolotherapy, over time, you know, the whole process usually takes about 6 months. Doesn't take 6 months to feel better, to get the swallowing back to normal, and the shortness of breath to go away. But actually to resolve it, it can take that amount of time. You know, choking is a really significant problem. And if you haven't found a solution for it, we'd encourage you to get an evaluation to see if you have cervical instability. And the cervical instability most likely is causing some vagus nerve damage. By doing curve correction, getting your computer set up high, some exercises to do, and receiving prolotherapy to resolve the instability, the nerve supply can get restored back to the epiglottis and the vocal cords, and the choking sensation can be resolved.